Hey everyone, I'm Nikola Dragojlovic. I'm the residency program director at UTHealth Houston. I am very happy to have heard Ben Seidel's Yeehaw. It's the most New York yeehaw I've ever seen, but I will take it. Um, I'm gonna pull up my slideshow and we'll get started. My slideshow is relatively short, so that way we have some more time for questions. And of course, if there's anything that comes up afterwards, you can put questions in the chat and I'll put my email in there if you need to contact me later. The other thing I will mention is that on our residency program website, we have a link to our video from another video platform, PM&R Scholars, that we did recently, last application season, I should say. And so you can always check out that video for some more granular details about our program, like call structure, procedure numbers, etc., if we don't get to answering your questions today. So I want to introduce our parent organization, UTHealth Houston, right? We are the ninth largest medical school in the United States, and we're based in the Texas Medical Center. The Texas Medical Center is the largest medical complex in the country. It's home to four academic hospital systems, of which UTHealth Houston is one of the largest, two level one trauma centers, over 100,000 employees and healthcare workers work in the Texas Medical Center. And between like the four academic hospital systems, there's over 10,000 patient beds. Literally, people come from all over the world to the Texas Medical Center for their medical care. And so it's an extremely fun and bright and dynamic place to work because the cases that we see are just absolutely incredible. And the people we get to help and their stories are amazing and really fuel us every day. So UT Health itself, though, has over 1,500 faculty and 1,200 residents and fellows across all its GME programs. And our primary affiliations are with TIER, the large freestanding hospital for rehabilitation in Houston, the Memorial Hermann Hospital System, which is the level one trauma center we're affiliated with, MD Anderson Cancer Center, which is a large freestanding hospital for care with people with cancer, and then Harris Health, which is Houston's safety net hospital system. Our department was founded in 1993, and now we've got over 30 faculty that staff TIER and other Memorial Hermann facilities for consults, inpatient rehab, and outpatient care. TIER has a neuro recovery research center that has over 10 research faculty and like $1 billion in research funding. Our residency program has been home to TBI model systems and SCI model system participation for like over 4 decades. So the cases that we see and the volume that we see are really strong for neurologic rehabilitation. And we are a 4-year ACGME accredited residency program. So your intern year, which we'll hear a little bit more about shortly, is going to be based at our level one trauma center with internal medicine residency department, but that's been custom tailored for PM&R residents. And then we offer fellowships in brain injury, spinal cord injury, and limb loss rehabilitation, or its new name is trauma amputee rehabilitation, which is so cool. So what sets our program apart from other residency programs? Well, I think first and foremost, we have a very small class size. Uh, and whenever you're working with faculty, you're working with them one-to-one, right? It's you and the faculty member when you're in clinic, when you're on the floors. And so you get a lot of face time with our faculty members, and that time that you spend with them really helps you build close relationships with all the faculty that you work with. You spend a lot of time with classmates, sharing spaces, working together. And one of the things that I'm really proud about as program director is that our residents are closely involved with me and the rest of the program leadership. So when there's things going on, when we need to find solutions to challenges, we're all working together, right? And that's something that I really value. Resident input is extremely important to me, and I like to involve our chiefs and all our residents actually, involved in the behind the scenes and all the things that we do to move our residency program forward year over year. Um, I think another special thing about our residency program is what I call the UT family and the alumni network that you get being a graduate of our residency program. You can build lifelong connections with faculty members, with former graduates who will serve as a huge professional resource. Our graduates are people who are medical directors, professors, chairs, program directors, people doing amazing things all across the country. And you have an automatic pipeline to those people for networking. And in physiatry, we know that's so important. And then because you're a University of Texas employee, you get really good pay and really good benefits, right? And Houston is the fourth largest city in the country. It's the most diverse city in the country. It's very affordable, tons of parks, museums, great nightlife, diverse neighborhoods, really friendly for, people with families, really friendly for people who are single, all pets, cats, dogs, iguanas, whatever, you're welcome. So our main leadership is myself as the program director, Dr. Frontera, our vice chair of education, and Dr. Jacob Joseph, who's our assistant program director. So when you come interview with us, you'll be seeing our friendly faces. Dr. Francisco is our department chair, very well known in PM&R circles, and is a huge advocate for our residency program. One of the things that I love to tout and boast about is that every single time I've come to Gerard with an ask for something for our residency program, he's always said yes. So I have a streak of like 9 for 9 asks, and I'm not trying to break it anytime soon. So his generosity and his willingness to make our residency program great and updated is amazing. And then of course, Kathy Brown, our program coordinator, is really a mama bear for all of us. I mean, she is really the glue that like keeps us all together. And I talk a little bit about the UT family earlier, but it's probably the thing that's most important to me in our residency program. And one of the things that I value so much is that, because we're a smaller group, we look out for each other, we stick together, we have each other's backs, as they would say. And you'll literally have friends for life when you leave our residency program. And it's one of the reasons that I've stayed on as a faculty member, right? I was a resident in this program. I was a fellow, then I stayed on as a faculty member, and then I became program director. And it's because that this organization means so much to me because of all of the things that it's given to me and all the opportunities that I've been able to give back. So our home is the Texas Medical Center, which you see in the foreground, this giant cluster of buildings. Those are all hospitals and hospital-associated facilities for the most part. 4 academic hospital systems, 2 level 1 trauma centers in the same area, just unprecedented patient volume, patient diversity. Every single language that's spoken in the world is spoken in the medical center. And you can see Houston's downtown in the background there. There's this really cool 4K fly-through of the Houston Medical Center, the Texas Medical Center. It's a couple years old at this point. There's a lot new buildings that have come up since this was made, but it gives you some sense of like the size and scope. It really is like, its own downtown, so to speak. And it's really fun to be a part of such like a dynamic place in medical care. So let's talk a little bit about our curriculum. So we have protected Thursday morning didactics and with monthly grand rounds. When you come to those Thursday didactics, no one is supposed to be calling you. You're not carrying the pager or anything like that. The attendings are taking care of the patients, right? You get breakfast, parking every Thursday. And we also offer site-specific didactics. So when you're rotating at tier, for example, there are didactics every Monday with lunch. When you rotate at one of our electrodiagnostic sites, every Thursday or Friday afternoon, they have more didactics. And so in addition to your protected weekly didactics in our residency program, there's site-specific didactics that you access. We have a research course that teaches you how to be a steward of medical research and basic research principles. So you're aware of like what makes good papers and what makes bad papers bad ones. And this culminates in what's called our critical review, where our residents will pick a topic to study and present on. And we're always jostling with the Baylor College of Medicine residents for the winner of the critical review competition every year. So it's a lot of fun. And many of our residents have turned their critical reviews into like meta-analyses or papers and publications, presentations at national conferences. So a lot of good things can come out of that. And part of our curriculum is also regular workshops, right? We very much do not believe in the didactic model where somebody just talks at you, kind of like I'm doing right now. We really try to make things more hands-on. So we have workshops for physical examination, prosthetics and orthotics, spasticity management, backup and pump emergencies, right? All kinds of ways to get your hands dirty and learn in different ways apart from lecture. But there are some additional programs available through our parent organization, McGovern Medical School. One of them is a physician educator certificate program. So for those of you who are interested in teaching, you can get enrolled in a course on how to be a better teacher to adult learners and medical students and graduate medical education specifically. And then there's also a month-long program called the Certificate of Healthcare Management, and that's like a mini MBA. So for those of you who are very entrepreneurial and interested in the economic side of healthcare, this is a great way to get your feet wet with all those economic principles and understand the economic foundations of our healthcare system. We try to get you as many educational perks as we can while you're a resident here. We help you join the major societies. We will get you the AAPM&R Q Bank and the AANEM training programs and Q Banks. Every year, we'll send you to the Kessler board review course to help you prepare for the future board exams you'll take. You get $400 every year for books, $1,500 every year to travel and attend conferences. And we've got a bunch of portable ultrasound machines laying around. So if you ever want to, diagnose someone's, tarsal tunnel syndrome, or, your co-resident's meniscal tear, you can knock yourself out. We have very generous leave policies as a government organization, UTHealth Houston. You get 3 weeks of paid vacation per year. You have FMLA, of course, that's available from the moment you start residency, and those benefits are maintained. And we are a very family-friendly program. We love to have our UT babies. In the last couple of years, we've had 3 or 4 UT babies come through, which we are always happy to see the UT family grow that way too. And the main thing, though, that I want to highlight is that we are always supportive of time away for appointments that you may need, whether that's like personal, family related, doctor's appointments, physical therapy, etc. We are here for you and support you through your residency education. So let's talk a little bit about our rotation sites. So this is our what we call our longitudinal curriculum, and I'll get to what that means in a moment. But as a PGY1, you'll see that you have 4 months of inpatient medicine. So think internal medicine floors. And then you have 1 month in the medical ICU. So that's going to be like the bulk of your medical experience training as a PGY1. That's going to set the foundation, your knowledge base for, your future inpatient rehabilitation rotations or any future inpatient work that you do as a graduate. And then the remainder of the rotations in your intern year, we've cultivated to try to be very relevant to physiatry in your future practice. So you have 2 weeks of geriatric inpatient floor service. You have 4 weeks of the neurology stroke services at our stroke center at Maine Memorial Hermann. You never hold the stroke phone, right? And as a PGY1, you're not going to be the person, taking all those calls, right? You always have very many levels of, protection and guidance in terms of like upper level PGY3s and PGY4s and senior residents and fellows. So I promise you it's not as scary as it sounds. But then you have consult services with rheumatology, cardiology, infectious disease, palliative care, outpatient medicine subspecialty clinics. And then as you get into PGY2, you start doing more of your inpatient rotations at tier. Voorhees Jones is our inpatient rehabilitation service at Maine Memorial Hermann, the level 1 trauma center. And so that's kind of like a general rehab unit with a mix of like LVADs, organ transplants, thoracic or lumbar or cauda equina spinal cord injuries, mild to moderate traumatic brain injuries and strokes, like sort of like a just general inpatient in-hospital unit. You'll see you have consults every year. You'll see you have PD rehab every year, right? You get prosthetics and orthotics as a PGY3 and a PGY4. Lots of longitudinal experiences with electrodiagnostics and musculoskeletal services and outpatient clinics. As PGY3, you'll continue those things, but you start rotating at MD Anderson for their cancer rehab rotation and our pain rotation, both of which are associated with their respective cancer and pain fellowships. Those have been super popular with our residents for obvious reasons. Amazing patient populations to work with, amazing faculty, amazing hospital system to be a part of. And then as a PGY4, you'll definitely get more time to shape your educational experience. You'll do 1 month as an acting attending, where you're the medical director at our 4 East Jones inpatient rehab unit, and you will be paired with a PGY2 who's doing their first rotation at 4 East Jones, and not just to be the medical director, doing team rounds, liaisoning with families, deciding on admissions, but also to be the teacher and to be the mentor to a junior resident. Um, and you'll see as you go through PGY4 that the idea is to do some rotations as a PGY2 and come back to them with new skills as a PGY3, and then come back to them with new skills as a PGY4. And so we feel like these longitudinal educational experiences do a really good job of helping you build your independence, while also having the support that you need given the closeness of the faculty that we have and the diversity of experiences that we can offer in the medical center in terms of inpatient, outpatient, consult services, the full breadth of PM&R.
Just a 5 minute warning.
Thank you. Talking about our rotation sites, TIER is our primary rotation site for inpatient and outpatient services. It's a large freestanding rehab hospital based in the Texas Medical Center. Maine Memorial Hermann is our primary level 1 trauma center, right? It is home to Life Flight, and is the busiest level 1 trauma center in the country. It's a stroke center, organ transplant center, heart and vascular services, and that's where we have our 16-bed inpatient rehab unit. And then the Lyndon B. Johnson Hospital, which is the Harris Health Hospital System, is Houston's safety net hospital. It's Texas's busiest level 3 trauma center on the northeast side of Houston, that has over 80,000 patients a year. And so we have busy consult services and a joint PM&R orthopedic surgery clinic and electrodiagnostics there. And then, of course, MD Anderson, we were talking about it a little bit earlier, ranked as one of the nation's best cancer hospitals. You'll do cancer rehab rotations there. You'll do pain, interventional pain rotations there. And both of those are affiliated with the cancer rehab and pain medicine fellowships at those institutions. So a lot of face time with fellows and very prominent attendings in cancer rehab and pain medicine. In terms of where do our graduates go, if you look at the last 3 or 4 years, you'll see people doing lots of things like a lot of other residency programs across the country have a lot of people going into pain, but the matches at pain are all across the country, right? Northeast, Midwest, the South, the West Coast. And then some of our graduates go into private practice, right? Do consults, they do inpatient rehab, maybe they'll do cancer, maybe they'll do brain injury fellowship. Suffice to say, when you graduate from our program, you'll be prepared to do whatever fellowship you need or whatever practice setting you want to go to. So everyone always wants to know like what's coming next in our residency program. We have some really fun things coming up. We've expanded our sports medicine rotations with the Family Medicine Sports Medicine Fellowship. So that has really cool opportunities for like sideline coverage and didactics with the Family Medicine Fellowship. Really excited about that. Our interns are doing a 2-week elective with anesthesia on their pain management service. So they're doing tons of like perioperative blocks and medication management as PGY1s, which has been really enjoyable for them. We talked a bit already about that longitudinal curriculum that gives you access to increased mentorship and more time with senior and junior residents to augment your education. And we revised our mentorship program this year into houses. So at UT PM&R, we take 4 residents a year, right? So we've got 16 residents altogether, and we've got 4 houses. So we've got a couple faculty members in each house and a PGY 1, 2, 3, and 4 in each house. And each house has its own like little identity and ability to schedule their mentorship and meetings and activities that they do together. And it's already been a lot of fun. So I'm going to stop my sharing. and answer any questions that people may have about our residency program.
Feel free to type in the chat or you could raise your hand and we could call on you also.
So for those of you who are wanting to look a little bit more granularly about our schedule or our procedure counts, feel free to check out our website. We have some videos from last year's application cycle that are on there. So questions in the chat. Are there ways for applicants to get exposure to the program if they're not able to rotate, like meet and greets or outreach from current residents? Absolutely. So leading up to the start of or the opening of applications, we will definitely have another virtual meet and greet opportunity that you can be a part of. So look out on our social media for how to sign up to that. But you can also email me and I will very happily connect you to our chief residents and you can pick their brains about anything you want to know. Favorite Houston go-to food place for the program. Oh man. Okay. So if we're talking about getting food for the program, my favorite place to get food for the program is probably Papacitos because they do fajitas really, really well on the cheap. And their tortillas are handmade and very buttery. So if I have to pick that place for our residents and our lectures and stuff, that I will choose every single time. What qualities do we look for in fourth year medical students rotating? Looking for a record of academic achievement, looking for interest in PM&R, looking for people who are not afraid to hustle. Our clinics are really, really busy. Our clinics are have patients with a lot of needs and come from very diverse backgrounds. So people who are ready to be team players, like Dr. Seidel said, right? It's physiatry. You got to be ready to work with people from all walks of life all the time. And we're looking for you to come for an educational experience too, right? You're going to be working with our residents, you're going to be working with our fellows, you're going to be working with our faculty, and you're there for a learning experience, and we want you to be invested and involved. Um, Someone asked to take step two or not to take step two, the question of the century. That's a very specific question, but generally speaking, I think it's better for you to take step two and have your scores available for residency programs to review during the application season. I was wondering if you could share what qualities or experiences your program considers most important when selecting applicants to interview. Sure. I spoke to it a little bit earlier with our, what we look for in visiting students too. So, I mean, we are looking for people who are not afraid of a challenge. I do not hide the fact that our program is very busy and that you will work very hard in our program, seeing patients, seeing consults, doing procedures, but you're going to see like hundreds of everything. And that's the point of residency training, right? Is for you to see a lot, do a lot, and to teach a lot. So we want people who are up for that challenge. Um, we like to have people with like a diversity of interests, right? We're always trying to recruit people who have like come from different backgrounds, different walks of life, and have different activities that they want to do. We're in Houston, so it's pretty hard to ski down here. But we have residents who are interested in like the arts. We have residents who are like former professional athletes. We have residents who are total nerds. And I like having that like full breadth of different types of people in the program. But in terms of qualities, we're really looking for people who are team players, who are not afraid of challenges, and who are also good self-starters. And the reason why I say that last thing about being a self-starter is because our program has a lot to offer, but we're not going to spoon feed you, opportunities for success. We expect you to come to the table ready for like things you want to do, things you want to achieve, but we will help you get there.
Just about two
Do
more minutes
we
of questions.
say that again?
Just 2 more minutes of
Few
questions.
more minutes of questions. Do we welcome reapplicants? Absolutely. I think if any concerns about reapplicants, no. I mean, it's PM&R. It's become very competitive, and there are going to be many reapplicants this cycle. That's the nature of our specialty right now. I think the most important thing for reapplicants to do is to emphasize their commitment to our specialty and what they've done differently or what they've learned or how they've grown over the last year. And the other thing is to make sure you have a strong letter of recommendation from your current program director. Geographic background. Do you tend to have more Texas applicants? So yes, I mean, we do. That's just the nature of Texas, right? So there's a couple places across the country that tend to have a lot of applicants from their own areas, right? So Texas gets a lot of Texas applicants. California gets a lot of Cali applicants. New York, New Jersey, Connecticut gets a lot of tri-state applicants. That's just the nature of the beast with these types of places. However, we are always trying to recruit residents from out of state, right? Or from out of the country, right? We're very IMG friendly. This year we have this most recent year we matched an IMG from Ecuador and a resident from North Carolina and a resident from Louisiana. There was only one person from Texas, right? And in previous years, we've recruited outside of state lines too. So we very much welcome people from outside of Texas. And that's the thing about Houston, right? It's actually very rare in Houston to find people who are natively from Houston. Houston is a place where people come to like be successful and grow professionally and personally. And so Houston has so many people from other places that we really welcome you into that fun, diverse, Houston way of life. So you can be a native Houstonian too. Um, Smidge on how protected didactic blocks are scheduled. Yes. So we have a um, didactic structure that's 18 months long. So when you go through the residency program as PGY 2, 3, and 4, you will complete all of the didactics twice. Didactics are protected from about 8 a.m. to 11 a.m., sometimes 8 a.m. to noon every Thursday. And then so that second of the half day, you'll show up to clinics, inpatient rotations, and do your thing. And if you're on inpatient rotations on protected didactic days, then we make sure that you split the work with your faculty. Our lecturers are a combination of UT Houston faculty, but then we also have lecturers from Baylor College of Medicine PM&R faculty because they're right across the street. But then we also have resident contributions to didactics too. So just this week for our brain injury course, there are 4 lectures going on. 2 of them are from faculty. One is from a visiting psychiatry resident, and one is from a PGY3 PM&R resident on psychopharmacology. So we really try to balance faculty input with resident education opportunities as well.
Sorry to cut you off. Thank you so much for your time today. We really appreciate you taking the time to speak with us. And if the students are allowed to contact you in any way, would you mind dropping that contact information in the chat?
Yep, y'all can email us, and then you can find us on Insta and X as well at that handle.
Awesome. Thank you so much for taking the time to come speak with us. We really appreciate it.
Thanks, everyone. Have a great evening.